Let's Talk, a podcast series from Hazel and Betty Ford. I'm your host, William C. Moyers. People drink or take drugs for a lot of reasons, usually to heighten the highs, like on a special holiday, a special occasion, a party, or on vacation. Or they use substances to mitigate the lows, like at a time of the loss of a loved one, or to ease the stress after a tough day at work or at home taking care of the kids. But people also drink or take drugs when there may be no obvious motive, or at least they aren't aware of one. And today we're going to talk about the role that anxiety plays in the use of alcohol and other drugs. My guest and my colleague, Sarah Wicks, a clinical psychologist in mental health at Hazel and Betty Ford. 18 years you've been in this field, yes?
15, but...
15?
Yeah.
Well, I'm so glad that you're with us today, Sarah. Thank you. Talk about the role that anxiety plays in the use of substances.
Yeah, well, anxiety can be kind of a sometimes very obvious cause of use. Some folks that come in for help that I'm working with are very aware of how anxious they've been and how they absolutely, I needed to drink to be able to sleep or to be able to deal with stress at the end of my workday, and they're just very aware of it. And then others aren't actually as aware of it, because it's possible to have a pretty positive outlook and still be anxious. I call it relentless optimism. But there's some sense of avoidance through using kind of a positive attitude to actually avoid dealing with things. And then there can be a lot of anxiety that comes with that. Anxiety can also be like the lid to the jar on a whole bunch of other emotions. And so when we're trying not to feel our feelings, especially the hard ones, then that can manifest as anxiety. And then problem with using is that it's the best and worst solution to the anxiety, right? Like in the moment, the drugs, alcohol, it works. It takes it away, it brings you somewhere else. You just don't care as much about whatever was making you anxious. And so it works in the moment. Then you sober up and everything that was stressing you out is still there. And now you also maybe have some guilt about dealing with it in an unhealthy way. And so then using more of the substance to try to cope with that, not only the initial stress that you were dealing with, but now maybe some of the guilty feelings about maybe you missed an important deadline or a family function because of your use. And so now you've got the original anxiety, then all these other feelings of guilt and shame and whatnot kind of compounding that, and it turns into a vicious cycle then.
So how does anxiety affect the body?
So anxiety, at its core, it comes down to the central nervous system, and we've got a sympathetic nervous system and parasympathetic. So the sympathetic nervous system, think fight or flight or freeze response, and parasympathetic would be our relaxation response. So the sympathetic nervous system, it's there for a very important reason, and this goes back to, I say this comes from also Steve Hayes and acceptance and commitment therapy. He always talks about how our ancestors were the anxious ones. Like they were the ones scanning the savannah for the tigers. They didn't get eaten, so they passed their anxious genes down to us. So we all, many of us have some sort of anxiety. But nowadays, most of us have to watch for tigers out on the savannah. But we still have that active fight or flight or freeze response that can show up. So it shows up in response to a real or a perceived threat. So any kind of perceived threat, we can get anxious about.
And is anxiety a diagnosable mental health condition?
It is. So it's like most things, it's on a spectrum of people that have just a little of it to people that have a lot, and panic being maybe the most extreme form of it. And one of the things that I do in my work is talk to someone, get to know them, ask them questions to see if they have some anxiety, does it rise to that level of a clinical disorder? So things like if you feel like you worry in a way that is disproportionate to the stress in your life. If it's above and beyond what it maybe should be for how stressed you are, and it doesn't quite make sense how anxious you are or how nervous you are, but you can't calm yourself down. Even if you know it's irrational, you can't calm yourself down. And if that happens to you for 3 months or longer, that could indicate a generalized anxiety disorder. And then there's more specific types of anxiety with social anxiety or specific phobias, panic disorder, some of those things. So we, as a psychologist, I'm kind of teasing that out to figure out what we're working with.
And you talked earlier about the fact that people who are anxious, whether they know it or not, they'll use the substance, and it'll work perhaps in a short period of time. And then it's there again. But the point is that when somebody seeks treatment for a substance use disorder, so they're removing the substance because they're getting treated for it, and it's an abstinence-based recovery approach, but you got to deal with the anxiety too.
Right, right. Which can sometimes be the highest when they stop using.
Right.
Especially if, so someone who maybe has an addiction without a co-occurring anxiety disorder, they might stop drinking or using and really start feeling better. They call that the pink cloud, right? They're like, wow, I've got so much more energy and clear-headed.
Conquer the world now.
Yeah, right? Yeah. And then, but you take somebody with an anxiety disorder and they get sober and they're like, whoa, 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 I have no coping skills for this now. And the thing that my body wants most to deal with my anxiety is the thing I now can't have. So that's where we talk about the interactions between like an anxiety disorder and post-acute withdrawal symptoms and how that can be worse for some folks compared to others. But every day, this is what I always tell my clients, like every day that you're not using, you're training your body that you can do this. You can make it through this without a substance. And you're kind of building back your natural resiliency every day that you don't use.
And of course, that's a process. It doesn't happen overnight or in a week.
Yeah.
We talked earlier, before we began to record this podcast, about the role that therapy and medication play in addressing anxiety. Can you talk more about that now to our audience?
Sure. So some conditions like clinical depression or bipolar disorder, medications can be extremely effective and even necessary for some folks to take. Anxiety is a bit different in that regard. There are some medications that can help with anxiety, but unlike other mental health issues, the research consistently shows that therapy is equally effective as medications in the treatment of anxiety. Anxiety in the therapy setting, anxiety is like the common cold. Like it's everywhere, and but unlike the common cold, it's more treatable. Like you don't have to just wait it out. There's things you can actively do. And you also want to be careful with anxiety medications. Some of them can be highly addictive.
Yes.
Benzodiazepines, things like Ativan, Xanax. You got to watch out for those for sure. And so the medications that can be more helpful would be in the class of like SSRIs. I'm not a psychiatrist, so I can't get too detailed about this. I'm not an expert in the area, but just having worked closely enough with psychiatry at Hazelden over the years, that there are some medications that can make a difference for some people they don't. But either way, therapy can help, and there's no side effects.
Just on that note, and before we go on, so people who are in recovery from a substance use disorder who are needing treatment, perhaps a medication for their anxiety, this is why it's important that they have a good relationship with their prescribing doc, so that the doc knows that they're in recovery. Because to your point, some of those substances can be addictive themselves.
They can. It's definitely something to watch out for. And I've seen people that get hooked on those kind of meds is some of the most painful post-acute withdrawals that I've ever seen.
Long time too.
Trying to get off the benzodiazepines.
One of your other important messages is the role that the breath and breathing play in helping to address anxiety. Share that with us.
Okay. Well, the reason I like talking about this is because, so I think one of the reasons I like working with people who are actually, they're coming for help because they have a problem with drugs and alcohol. And a lot of times they don't even want this fluffy mental health stuff. They're like, no, I don't want to learn breathing skills. I don't want to learn, like, whatever. Like, I just need to get sober. And so I have learned, I love working with these folks because I like seeing their change of heart, like once they really experience how helpful it can be. And so I've become a bit of a salesperson about like using healthy coping skills, learning them, trying them. And so I like talking about the science behind breathing because I get that cynicism a lot. Like, okay, it's just breathing. We all do it every day. But here's the cool thing. So remember I was talking about the parasympathetic nervous system and the sympathetic nervous system. There's some very specific ways that you can deactivate your own fight or flight response, deactivate the sympathetic, and activate the parasympathetic. And so when we're breathing, when we're hyperventilating, when we're nervous, that's actually a result of not fully releasing all the air out of the lungs. So if I'm forgetting to exhale, I'm just breathing in and in and in. There's no room for that fresh air to get in there. So the first part to the breathing exercises that I like to emphasize is the exhale. So nice long exhale. You're fully emptying your lungs, and that allows the fresh air to get into your lungs. And the oxygen, we have more oxygen receptors at the bottom of our lungs than anywhere else. So that fresh air, the oxygen has to get down to those receptors, into the bloodstream and up to the brain, and that's what's going to give the parasympathetic relaxation response. Not just breathing, but that oxygen specifically. So
Would the power of conscious breathing, would that also equate to the practice of yoga or to other meditative-like activities?
Sure, yeah. It's, I mean, yoga is the breath is a really critical part to that kind of practice. It's one of the reasons, I mean, I'll work with folks who are athletes and maybe they love, exercise and sports, but they don't want to practice mindful breathing. I'm like, well, guess what? You already are when you're in sports. That's part of the reason, those things can be so helpful to us is because we're getting deep breaths and releasing the air and getting the fresh air in there and whatnot. So,
and we have about 2 minutes left, but share with us a little bit about the role that anxiety plays in the family dynamic. So we know we started our podcast talking about anxiety and its influence and impact on somebody with a substance use disorder. But of course we know that a substance use disorder affects much more than just the person who has it. It affects the whole family. Do you see anxiety in family members? Do you see depression and other things as a result of a loved one's addiction?
Absolutely. So family members, and I do work with family members specifically, as well as people in their own recovery. I run groups for family members and see them individually. And the anxiety that can show up is often, it often rises to the level of like a trauma anxiety. Because the definition of trauma is you or your loved one being in a dangerous situation. So there it is, somebody who's really heavily drinking, using, maybe they're driving, maybe they're operating machinery, maybe they're, tripping, falling, getting injuries. They're in dangerous situations, and this can be kind of a chronically traumatic thing, and the result of that kind of traumatic anxiety can linger quite a bit even after the person is sober. Maybe the loved one has been sober now for 6 months or a year, but we're coming up on anniversaries of that 4th of July that was a nightmare, or we're coming up on the anniversary of the birthday party that went south, and that's going to bring up anxiety oftentimes more so for the family member than the person who's actually in recovery themselves, because maybe they were blacked out, maybe they don't even remember, but the family member sure does. And so trying to give family members a space to work through that is really important as well.
Yes. Last question before we go. What about patients or clients who have an aversion to mindfulness practice? What are they supposed to do?
Oh, good old mindfulness. Well, I love mindfulness and I'm a big fan. I teach it to most of my clients, and I think it's critical to learn the language of recovery. It's building a part of the brain called metacognition, the ability to observe our own thoughts and feelings without just impulsively acting from them. So really critical life skill to have. And there's people who flat out, it makes them incredibly uncomfortable, really increases anxiety. Mindfulness isn't going to work for panic disorder, for those really higher levels of anxiety. So for folks that don't want to do that, I recommend things like classic cognitive behavioral therapy is not
CBT.
CBT is not a mindfulness-based approach, and it still works. It's still out there.
Yes.
It's been around a while, but it works. So that could be, there's also, I run some dialectical behavioral therapy groups, DBT, and there's a section of DBT that does focus on mindfulness, but there's other sections that give you a variety of other tools as well, like the breathing. There's various breathing exercises, for instance. There's things you can do with ice and cold water, and changing your body temperature, progressive muscle relaxation. There's some guided relaxation techniques, because mindfulness in itself is not necessarily a relaxation technique. It's a way to bring yourself to the moment and be open to anything you're experiencing in the moment without trying to relax yourself. So it's a little unique in that regard. But then there's other exercises where you are actually practicing relaxation that some folks may like those better.
Well, thanks for bringing us all these good options for addressing anxiety, and your expertise is making a huge difference, not just in the lives of the patients and their families that come to Hazel and Betty Ford, but our audience today on this podcast. Sarah Wicks, thanks for being with us today. And thanks to all of you for tuning in. Remember, if you or a loved one need help for addiction, don't wait. It is okay to ask for help. Help is available, treatment works, and recovery is possible. We'll see you again.